morning and a very warm welcome to the founders of Sehat Kahani, Dr. Sara Saeed and Dr. Iffat Aga. Sara and Iffat, fabulous to have you here today. I remember meeting you both in person when I was in Pakistan a couple of years ago. You know, it was a small office, big idea. And today in 2021, it's just fantastic to see how well Sehat Kahani has grown. Sarah, my first question to you. Tell us more about Sehat Kahani and what prompted you and Iffat to take this bold step.
The basic idea is to democratize healthcare access for all using technology. And it stems from two basic health problems that we see on Pakistan at a supply and demand issue. So on the supply end, Pakistan has around 200,000 doctors, 60% or more are female doctors, but unfortunately, only 23% of this number ever practices. Majority of our medical workforce, despite being female doctors, are made to sit at home after marriage or children because of a phenomena that we call the doctor bride, which means that they have a degree, but they're not allowed to work. What it does is in a population of over 200 million people, half of our population, mostly women and children residing in the rural areas, don't get access to a qualified doctor or quality healthcare. And that really impacts our health indicators and the overall health of the country. So when I graduated, I also became a doctor bride. I was married and I couldn't work because I had a child and I was in a new city. And before leaving my old city, I was doing a clinic in a low-income community. When I left, because of political issues, they couldn't find a doctor to replace me. And the nurse of that clinic started to call me and say that the patients are here and there's no doctor. So I started doing on-call consultations through the nurse with the patient, and later on it turned to video consultations. And that kind of gave birth to this concept that if I, being a female doctor sitting at home, can provide consultations to patients in far-off communities, why can't this big network of 85,000 doctors who are made to leave work and sit at home can still provide consultations to all patients who can't see a doctor in their community? And that led to the creation of Sehat Kahani. And I think 3 months when we were working into the idea, my co-founder, Dr. Iffat, also joined in. And she, through her life, had also seen the struggles of a female doctor and a working mother and a working wife. So she also resonated completely with the idea. And together, we started creating Sehat Kahani.
That's really a fantastic introduction to Sehat Kahani. Iffat, this question is to you. I know you are the CEO and co-founder. What have been some of the operational challenges that Sehat Kahani, has faced? There are, both you're dealing with a doctors who initially were not allowed to be a part of to go into work. B, you're also dealing with the setting up clinics in rural areas. So tell us some of the challenges that you faced.
I think it has been a very interesting journey. And when we started off with the concept of having telemedicine in low-income communities, the biggest challenge was that communities, or unfortunately women in the communities, are very influenced by the men in their household. So having to get the buy-in from their husbands, from their fathers, that this is a safe space, that they're actually speaking to a proper qualified physician, and that it's not any other form of, global agenda or any person making their video or anything. So I think the initial challenge was convincing them. I think we were successful at it because what we did was we started to get nurses from the community. So people knew them already. They trusted them already. We started to get community mobilizers whose role was to engage with women, sit with them on the floor, give them a demo that this is how it works. This is a doctor who works. All the way from a leading city or a leading hospital. So I think that's how we were able to manage this challenge. But I think on the other hand, female physicians took it up, with a lot of excitement. A lot of female physicians started to become a part of our network. But I think as female founders, we had our own set of challenges. We would take this idea to different organizations, different corporations, and initially they would all think, who would, engage with the physician online, who will speak to a doctor online, who will, become a part of this consultation. This is not going to happen. Also, since, Pakistan is a very patriarchal country. So two women doctors who have stepped up and who want to bring a large number of females back to workforce obviously, had its own challenges. But I think with time we have proven the success as large number of doctors have joined the network, as we've built the technology. We have been able to gain their trust. But I think these were the major challenges that we felt.
You're right. You touched on multiple areas in terms of what the challenges have been. I think people underestimate the Herculean effort that's gone into bringing, the female doctors back into the fold. Sarah, my next question is for you. You have, your model has pivoted. You've both have a brick and mortar with your clinics in the urban slum and rural areas. You've also created an app which you have now brought in corporates into the fold. Tell us about how this journey has been for you, and what has been the kind of adoption. How many consultations have you had since you started? How many corporates have you brought on, on your platform?
So I think Lathika, it was a very interesting journey in which we discovered ourselves and our potential as business leaders as well. So when we started with this idea that we will have clinics in low-income communities where people belonging to low-income sectors can come in, get checked by a nurse, and the nurse gets the patient to the doctor. While I think we were doing well, we realized three things. We realized that a clinic only has a small community which caters to. So the population that we're empowering for healthcare is limited. We also realized that only two doctors can work in one clinic. So ultimately, the change that we wanted to bring in a life of a female doctor and in a cohort of female doctors was not happening. And third, we felt that the sustainability of the organization was crucial, and we also had to add a high revenue vertical to create it a hybrid company where a high income vertical helps a low income vertical and both stay on float. And that is when we added the mobile application. And our learnings from the clinical model eventually transferred into the mobile application. The only difference was that in the app, the intermediary's role was not there. So because we were catering to a smartphone user and a literate smartphone user, they could download the app and connect to a doctor directly. One thing that we saw in our clinics really work is when a patient came to the doctor, the thing that they really like is there was no waiting lines. They didn't have to travel to another city to get a consultation done, and they were quickly connected to a doctor. So this is something that we made sure in our app as well. So our app connects the patient to a doctor in less than 60 seconds by an instant consultation option. And that, I think, really clicked with the customer that we were reaching out to. So when we launched the mobile application, we had two populations that could use it. One is a retail customer that can use it directly and individually. The other is a corporate customer, because in Pakistan, there is another issue that formal employees don't get outpatient coverage because it's very expensive for the organizations to give it to them. So we discovered a cost-effective way of giving our telemedicine app to corporate so that their employees can get connected to doctors without having any outpatient coverage. And this idea got picked up by the corporates really readily because it was instant, it was cost-effective, and it was convenient for them. So at this stage, post COVID-19, where the world started to understand the role of telemedicine as well, I think Sehat Kahani has emerged as one of the biggest companies in Pakistan, where we cater to now 753 corporates through individual accounts as well as insurance partners with which we work with. We've done over 550,000 consultations till date in our clinics, through our retail app, through our corporate app. We have the largest number of clinics by any private company in Pakistan, and we have overall created a network of 5,000 doctors who have become a part of this journey, from which we recruit doctors for our app as well as for clinics every day when we need new doctors.
Wow, that's just fantastic. Again, having been a part of your journey, it always is very exciting to hear where every month you seem to be increasing and accelerating, actually. Ifat, we've worked together as Microsoft. What has been the biggest area of support that we've given Sehat Kahani?
Yeah, so I think When we met as a small company, a small startup out of Pakistan, the biggest support that we got as we became partners with Microsoft was the endorsement that we got. So a lot of national as well as global recognition that Microsoft is that organization which is supporting the startup. We got an opportunity to work extensively with a lot of tech mentors with the support of Microsoft. So us as well as our teams got to learn a lot. We also got to explore how the technology can be further enhanced and made sufficient so that a lot of opportunities can actually be added into it. So, for example, till last year, we had an application which allowed access to physicians, which allowed access to consultations, but we also wanted, for example, a holistic view. If we wanted to have a look at a holistic summary and the number of consultations per day, the disease ailments, all of that. So I think with support of Microsoft, tools such as Power BI, we were actually able to create an entire dashboard, which now gives us, an entire snapshot and just a click that, okay, this is where we are in our journey at this point. And also with this program, we got access to a lot of credits, which again, as a young nascent startup, perhaps an organization wouldn't be able to afford. So all that tech support, all that support in terms of having access to Azure, cloud, I think that has really helped us accelerate the journey. And things that maybe we would have taken 4 or 5 years to do with the support of Microsoft, we were actually able to do it in a very short span of time.
Great, excellent. We're very happy that Sehat Kahani is now, part of Project Amplify, which is in partnership with Accenture. Sarah, my last question to you is that what are plans for Sehat Kahani? I know you've raised a small amount of funding. Clearly the opportunity in multiple fronts. Bringing back women, female doctors into the workforce. You said there are 80,000 of them out there, and you mentioned that your goal was 50,000 when I spoke to you. But where do you see Sehat Kahani in the next 3 years?
I think we're in a stage where we're exploring how telemedicine in different forms and ways can help any form of customer that is present in Pakistan. So we're rapidly expanding our clinical network. We are standing at 35 clinics right now. We want to reach to 102 clinics by the end of 3 years and really tap into all the possible internet-enabled low-income areas. We also are partnering with the government to convert basic health units into telemedicine centers, which is something which is very close to mine and Iffat's heart because these are dormant centers where a lot of public comes and does not find a doctor. In terms of a corporate application, we're discovering new avenues to reach to a lot of traditional companies as well, which includes maybe the building infrastructure, the textile industry, where there are a lot of workers working in factories but don't have outpatient coverage. So we're tapping into the heavy traditional industry now, as well as into new insurance partners with which we can increase our base to reach to around 570 or 500 or 600 corporates by the next 3 years. In the retail sector, we are working with telco partners now to reach the retail customer because we realize that the muscle that telco has of data as well as customers can be really helpful in making this product more achievable to them. So we're working with different telco partners to create bundled products, to create phone payment mechanisms within our application so that these customers can be tapped into the network. We're also starting an e-pharmacy chain, which will allow all our customers to have a cart within the pharmacy to order the medicine from. And ultimately, our vision for the next 3 years is to prepare the company for a Series A round so that we can expand our wings for expansion within Pakistan, but also establish Sehat Kahani as our first telemedicine player that establishes itself regionally as well. So we're also starting our homework for our strategy for international expansion. And I believe that by the end of 3 years, we would have tapped into at least 25,000 female doctors and reached to 8 million customers in the next 3 years.
Fantastic. I look forward to, partnering with you both and Sehat Kahani in your journey. Good luck. I think you all are doing phenomenally well, and I'm sure that you will reach the goals that you have outlined. Thanks, Sarah. Thank you, Iffat.
Lathika,
Thank you so much.